before we start any procedure, we as a student nurse should introduce ourselves to the patient. Next will be identify your patient by asking their name and by checking their wristband for clarification. Next will be explain the procedure to the patient and its purpose. Next is discuss any allergies of the patient from betadine or latex. Next is assemble all your equipment, do hand washing for this procedure, and provide good lighting and also provides patient privacy. So let's start. So good morning, ma'am. My name is Narina Padilla and I will be your student nurse for today. Ma'am, may I know your name? Okay, ma'am. Ma'am, may I see your wristband for clarification? Okay, ma'am, Mary. Ma'am, I'm going to insert a Foley catheter in your bladder. So, ma'am, this procedure is to ensure your bladder will be empty throughout your upcoming surgery. Is it okay for you, ma'am, if I'm going to start the procedure? Okay, ma'am. So, ma'am, do you have any allergies in betadine or latex? Nothing? Okay, ma'am. Thank you. So next is assemble your equipment, do proper hand washing. Next will be provide good lighting and provides patient privacy because this procedure will be uncomfortable to the patient and also they will feel embarrassed. So next is position your client in a dorsal recumbent, knees flex. So yes. So next is performing perineal care to the patient, instruct the patient about this procedure, provides patient privacy by closing doors, curtains, and treat the patient properly. And also next will be use gloves for this procedure, and next will be use a washcloth with a warm water to wipe the perineal area of the patient. So let's start. So wear a gloves. I'm doing a perineal care for you before we start inserting a Foley catheter. So use a washcloth with a warm water. So expose only the part that we will be wash or wipe. So the labia part side by side. So there and there, and the middle part. This. So discard your clean gloves. So next is don't forget to wash your hands for the next procedure. So next is open your sterile catheterization tray on a clean over bed table using a sterile technique. So here we have this box. So we have a plastic bag container now. So we will going to use this one for our cotton balls. So put it on the patient side. Next is opening your sterile catheterization tray in a correct way. So ensure sterile technique. So to away from us, side, and towards us. So as you can see, we have a sterile gloves. Next is our two drapes, one for the underneath the patient and one a fenestrated sterile drape covering the perineal area, exposing the perineal area of the patient. So use your gloves now. Sterile gloves rather. Ensuring that all in this box is sterile, so we need to use sterile gloves. So our one drape for the underneath the patient. So shiny down. So next is our sterile fenestrated drape to expose only the perineal area of the patient. So we are going to put only perineal area of the patient. next is we have a betadine, a lubricant for the catheter tip later, our cotton balls, forceps, and our sterile water solution. So put this tray on the side of the patient for better easy access on it. So next will be we have a catheter and a drainage bag. So so we need to connect it here, and our port. So testing your catheter balloon. So this is our catheter balloon. So this is will be inserting a syringe with sterile solution. So we have 3 ml solution. So insert, inflate the catheter balloon. So here. So as you can see, our catheter balloon is properly inflated. So right there. We'll leave your syringe over here. And also don't forget the lubricant. Our lubricant is for the catheter tip, so that the catheter tip will easy to enter the urethra of the patient. So dispose. So after we ensure our catheter tip is inflates properly, note for this, if the catheter is not inflates properly or leaks out of fluids, we need to replace it before our insertion. So next is using our thumb and our one finger of our non-dominant hand is spread the labia part of the patient, rather here like that. Then use a cotton ball with held forceps with a betadine. So this patient is not allergic to betadine, so we need to wipe it from the labia farthest from us, discard, then closest to us, discard, and next is the middle part, discard. So next is inserting the Foley catheter. So we have here our Foley catheter, a catheter tip. We need to dip in a lubricant so that it will easy to enter the patient urethra to the bladder. So instruct the patient to dip briefly. So here, let's start, ma'am. Dip briefly. I will insert the Foley catheter now, gently here, until there is a urine return. So right there. So next is hold the catheter securely here, then inflate the catheter balloon. Once it is inflated, we need to ensure that the catheter tip is in the bladder now. Tug it. If there's a resistance, we're done. So next is insert the tube on the patient thigh here. Then hook our drainage bag below or lower level of the patient waist and hook it into the side of the bed, not in the side rails, here, like this. So next is dispose all your equipment. Here it is, complete. And also our sterile gloves. Here. So after the insertion of the catheter, we need to wash our hands and remove and dispose all of the equipment that we use this procedure, and also don't forget to document in this procedure the insertion of the Foley catheter. So next is instruct the patient or inform the patient that the insertion of the Foley catheter is done. So ma'am, our Foley catheter is done. So how do you feel right now, ma'am? You feel better? Okay, ma'am. So drape the patient properly. So ma'am, I will leave you first and I will come back to remove your catheter. Is it okay for you, ma'am? Okay. So last procedure is we need to remove the Foley catheter and the patient bladder by the doctor's orders. So we have here our clean gloves, our cloth for supporting the catheter. Next is our syringe to deflate the balloon, the catheter balloon. So ma'am, I will remove your catheter by your doctor's order. So treat the patient. So deflate first the catheter balloon. Okay. So next is by using our supported washcloth. So here, like this. So ma'am, breathe deeply. 1, 2, 3, out. So the Foley catheter is now removed. So disposed. Next is we need to do a perennial care to the patient or assist the patient to the bathroom to wash your genitals. So next is position your client in a comfortable position. So drape first the patient properly here, and also dispose again. Wash your hands again and document all the procedure and the time of the removing of the catheterization. So that's all for today. Thank you for watching.